In this video, we'll be explaining the clinical steps of the jaw relation record procedure. To begin, have everything that you need in front of you. You will need upper and lower record blocks, Lacron carver, wax knife, a hot plate, fox plane, and Occlufast or any other bite registration material in addition to a heat source. This checklist provides the clinical step for the jaw relation record procedure, and we're going to have a look at them step by step. To begin, seat the patient in an upright position. Fit the maxillary occlusion rim and check the extensions and the fit of the rim. See how the occlusion rim is extended to the full depth of the vestibule with adequate relief provided for the labial frenum. If your secondary impression was good enough, then the record block will be retentive. Otherwise, you may use a denture adhesive to keep the record block in place so that the procedure will become easier for you. Next, you're going to check the nasolabial angle. The nasolabial angle is the angle that's formed by the bridge of the nose and the upper lip. You ask the patient to lick their lips and swallow and relax. The nasolabial angle needs to be around 90 degrees. For this particular patient, his upper lip is considered a little bit long, so I would like a little bit more support to push the lip a little bit. To adjust the occlusion rim, you're going to use the red base plate wax that's provided in the clinics. Gently heat a Lacron carver and cut a small strip of wax to add on the labial surface of the occlusion rim. Here we're adding labially to improve the labial fullness. So we're going to soften the red base plate wax and once it has softened, then you can adapt it to the labial surface of the occlusion rim. Gently adapt it so that you don't lose the thickness that you're adding. Then use your wax knife. Use the flat end of the wax knife to adjust the occlusion rim or to adjust the wax. So heat it over the flame as you can see. And then gently use it in a smooth brushing stroke to smoothen out and to blend all the wax together. Use the hot plate to fix any excess wax. Notice how the lip support had improved after we added one sheet of wax labially. Next, you're going to check the visibility. Ask the patient to lick their lips and swallow, and relax. For this particular patient, the maxillary or the upper lip is slightly long, so we'd like to make the visibility only about 2 millimeters at rest. So you're going to mark that 1 millimeter mark labially and then mark it on the occlusal rim all around. Use the hot plate to reduce the surface altogether up until the mark that you just did. Take it back to the patient's mouth. Again, put it in, ask the patient to lick their lips and swallow. And then you can notice that we have the desired visibility now. Okay, considering the length of the upper lip. Use the fox plane to check the level of the maxillary occlusal plane. The fox plane is basically a ruler. The anterior border measures the parallelism between the interpupillary line and posteriorly used for parallelism with the ala tragus line. Put it in the patient's mouth so the bite fork goes in and then you're going to check the parallelism between the maxillary occlusal plane anteriorly with the interpupillary line. You can notice it is slightly taller on one end, so I'm going to take it back to the Bunsen burner to reduce that excess. So you reduce it only on one end. Again, use the hot plate to heat that part and reduce it slightly. Again, take it back to the patient's mouth and you can see how the parallelism had improved. Next, check the parallelism between the occlusal plane and the ala tragus line. Use the mid of the tragus as your reference point. As you can see, it is parallel. Now it's time to determine the vertical dimension at rest and the vertical dimension of occlusion. Ask the patient to relax their lip and swallow, and mark 2 points on the tip of the nose and the tip of the chin of the patient while they are relaxed, and then adjust it using a tongue depressor, and this is your vertical dimension at rest. If you subtract about 2 or 3 millimeters from that, then you get the vertical dimension of occlusion. The difference between the two is the freeway space. The level of the mandibular occlusal plane is determined posteriorly by the retromolar pad. Draw the retromolar pad on the master cast and mark the 2/3 level up of the retromolar pad as the height of the occlusion rim posteriorly. Anteriorly, the level of the mandibular occlusal plane is determined by the corners of the mouth. So here I'm just using retractors to show you where to mark the corner of the mouth, or the modiolus. That is your reference point for the height of the mandibular occlusal plane. So after a few adjustments, the upper and lower occlusion rims are now in occlusion. After we have checked the VDR, VDO, the level of the occlusal plane in the maxilla and the mandible, in addition to the buccal corridors. Next, you're going to locate the midline. The midline is located by considering the face as your reference and not the nose, as for some patients it could be deviated. Next, you're going to mark the corner of the mouth or the mesial surface of the canine by taking the labiomental fold as your reference point. And you'll do the same on the other side. Next, you'll determine the maxillary anterior tooth height at rest, which is the visibility which we have already predetermined, and next the smiling, because this will determine the total height of the maxillary central incisor. So here you have the midline, low lip line, and the high lip line marked on the occlusion rim. Then practice the centric relation record with the patient by using the bimanual manipulation technique. Stabilize the upper occlusal rim with your left hand and then ask the patient to gently put their tongue up and backwards, and then gently ask them to bite down. Let them help them guide their mandible into centric relation. Here I'm marking a reference point and making sure that every time the patient bites down, he bites down into the same place, simply to ensure that this record is reproducible. Add V-shape indents on the occlusal surface of the mandibular and maxillary occlusal rim to make retention grooves for the bite registration material. Use the universal tray adhesive if you're using Occlufast or any other silicone material as a bite registration material. And gently just apply it to the occlusal surface of the occlusion rim. Load the tip of the Occlufast material onto the cartridge as you see. So there is a small indent that you need to secure it first and then twist, making sure that it's secure and safe before use. While the patient in a semi-supine position, stabilize the upper occlusal rim and then guide the mandible into the centric relation as you have just practiced with the patient. Ask them to roll their tongue up on the palate and then stabilize the upper occlusal rim and then gently apply the Occlufast material only in the grooves that you have just put. Again, ask them to lift their tongue up and gently close down until the rims are completely closed together. And the bite registration material is only between the V-shape indents that you have just created. Wait for the material to fully set and then remove it from the patient's mouth. Here you can see that I'm checking that the two rims are biting into centric relation record as the record that I've just predetermined beforehand and practiced with the patient. Remove the two blocks from the patient's mouth in one piece and make sure that they are not in contact posteriorly, because this will affect your VDR and VDO. Once done, wash it under the sink with running water and then put it in the disinfecting solution that you'll find in the clinics. Select the shade and the mold of the teeth with your patient and then take it to the lab for mounting and then tooth setup. Thank you for watching.